Good morning, everyone. Well, it's a pretty special day, so it's my pleasure to welcome you to the Raising the Beam ceremony. We're also pleased that we have our Vice President for Medical Affairs, Dr. John Robillard, in attendance with us today. And most importantly, it's also impressive to see such a great turnout of our physicians, nurses, staff, and construction crew. So fantastic. We are also excited that this is a dry day, at least so far, and that we're celebrating the major milestone with the construction project. So it is often stated that it is the simple things in life that bring comfort and happiness. The sight of the rising sun, the smell of fresh cut grass, the sound of children laughing. These sensory experiences are soothing and invigorating. They replenish. We have been extremely fortunate to have a team 600 plus strong, consisting of faculty, nurses, staff, construction crew, families, and the kids themselves, creating an environment that will promote healing and lessen anxiety. They have focused on lighting, safety, efficiency, and bringing fun into a building where the extraordinary will become our new everyday reality. This team is often referred to this experience as the WOW experience. The WOW experience is not a singular place or destination, but an overall feeling shaped by the shared compassion of the people who work here. We are all excited about the new Children's Hospital for what it will become and the promise it holds to improve the health and well-being of the children we serve. Truth be told, it is the collective commitment and dedication of our faculty, staff, and construction team that brings the WOW experience to life each and every day. So while we eagerly anticipate the opening of our new Children's Hospital, today let's celebrate what you have created and why you have created it through the signing of our final beams. A project as significant and as meaningful as the UI Children's Hospital does not progress without tremendous leadership. We are extremely fortunate to have that in the form of Ken Cates, CEO, University of Iowa Hospitals and Clinics. Ken?
Well, thanks, Scott. It's truly an honor to share this stage today with so many special guests as we gather to celebrate another milestone in the development of our new Children's Hospital. I think the spirit and courage and faith of so many children and families who face debilitating disease or devastating trauma have truly served to galvanize this massive undertaking, which will stand as a hallmark of children's health and well-being for decades to come. So today, as we raise the beam together and take pride of ownership by offering our signatures, I think it's fitting to acknowledge the definition of beam as a critical support structure, personifying the importance of everyone assembled here today, the wide array of faculty, staff, trainees, and volunteers who have and will continue to contribute their expertise and energies to achieving the mission of this world-class pediatric center of excellence. Now, while the building infrastructure is undeniably impressive, it's the remarkable complement of patient and family-centered caregivers and all those who render support of these services who bring our lofty vision and core values to life and make a meaningful difference in the lives of children with whom we are entrusted. On a similar vein, I want to extend our heartfelt gratitude to the litany of present and former patients, faculty, nurses, staff, youth, family, and community members who have and continue to provide vital input and support throughout the planning, design, and development process. As we enter this new era, we're truly fortunate to do so from a foundation of strength, already recognized as the only hospital in Iowa which is nationally ranked for pediatric care, including in 8 subspecialties. We also enjoy amazing partnerships with campus constituencies like the UI Dance Marathon and Hawkeye Athletics, who continue to lend their unique warmth and inspiration to the promising future of our pediatric patients. Given the supportive landscape and the instrumental stewardship of our capital management group and the on-site construction crews, we're building a legacy that'll reap dividends for generations to come. So as we visualize this triumphant future, we should all pause and take justifiable pride in your support of this building's construction and the hopes and dreams it will truly embrace. The smiles of joy from thousands of children in the years ahead will provide an apt tribute to the wisdom of this endeavor and the value of our collective efforts. Our new UI Children's Hospital will truly help us change medicine and change kids' lives. So it's now my pleasure to introduce the Geenan family. The Geenans are members of our Children's Advisory Family Advisory Council. and I know they have a very valuable story to share.
Thank you, Ken. Violet and Dave are sitting right there in the second row. 2 years ago, on the 26th, it was a Friday, early in the morning, I traveled to University of Iowa hospitals in an ambulance. I was 28 weeks pregnant, diagnosed with preeclampsia HELP syndrome, and would be delivering our daughter at 8:35 that night. Being our first pregnancy, our first child, terrified, scared, afraid were a few of the words to describe what we were feeling as we were journeying into uncomfortable and uncharted waters. That began to change once we were greeted by our medical team at the U, the ones who over the course of my recovery and Violet's 76 days in the NICU would become family to us. We didn't choose University of Iowa hospitals, it chose us, and we are grateful. 2 years ago, recovering from my C-section, laying hooked up to IVs and monitors in labor and delivery on the 6th floor, drifting in and out of sleep, drifting in and out of visitors as they came to see me and our brand new baby girl, Violet, weighing 2 pounds, 5.7 ounces, 14 inches long, who I hadn't even met yet. I caught glimpses of the scoreboard as the Hawkeyes played their spring game. 2 years ago, I heard about this big hole out my hospital window from Dave, my husband. We were told it was going to be the new children's hospital that we are today signing and later raising the final beam for. Dave and I proudly serve on the Family Advisory Council, where we share the conviction that when healthcare providers, patients, and families work together, that is when excellence in healthcare happens. We have seen it with our daughter Violet's care, and many of you see it each day. Patient and family-centered care provides hope in what many times feels to be a hopeless situation. 2 years ago, our lives changed forever. We became parents, parents of a preemie, parents who learned to navigate cords, wires, and tubing like it was all a normal part of our daughter's body. Parents who, in her daily care, learned to say yes, ask why, and firmly say no on occasion. Parents who spouted off acronyms, procedures, and terminology like it was a regular part of our vocabulary. Parents who attended rounds, were brought into the conversation and care and plan for Violet each day. Parents who lived in their home away from home at the Ronald McDonald House. Parents who became invested in the University of Iowa Children's Hospital because it became invested in us. 2 years from today, 5 years, 10 years, 20 years, it is our family's dream that this hospital will continue to be on the cutting edge of innovation, care, and excellence. So thank you, University of Iowa Children's Hospital. Our daughter Violet, who will be 2 in 2 days, is a healthy, vibrant, spirited, running, talking, singing, bubbly, bubbly, bubbly child because of you. Thank you. I'd now like to turn the podium over to Dr. Raphael Hirsch, the Physician-in-Chief of the UI Children's Hospital. Dr. Hirsch holds many academic titles, as you can see from the program, including his role as Professor and Chair of the Stead Family Department of Pediatrics. Let's welcome Dr. Hirsch and thank him.
Well, thank you. It's great to see so many friends and colleagues here today. And the story you just heard is a perfect example of why we're doing what we're doing here. There's a story told in the Talmud. Where's George? George will be able to tell you later what the Talmud is. There's a story in the Talmud about a traveler who was passing through a small village, and he saw an elderly man planting a small sapling. And he stopped to watch. And the man was very frail because he was very old. And he carefully and with great difficulty dug a hole into the ground, put the sapling in, spread the roots out, gently covered it with soil and patted it down. drove a stake into the ground and tied the sapling to the stake so that the wind wouldn't blow it over. And the traveler was curious, so he walked up to the elderly man and he said, "Excuse me, sir, what type of tree are you planting?" And the old man said, "It's a fig tree." And the traveler said, "Well, I don't mean to be presumptuous, but a fig tree takes 30 years to bear fruit. Do you expect to be here in 30 years to harvest the fruit from this tree?" And the elderly man replied, "Perhaps not." And he leaned on his spade and pointed across the field and said, "Do you see those trees over there?" And the traveler looked and he saw a grove of big mature trees, heavy with fruit. And the old man said, "You see those trees? My father and his father before him, they planted those trees so that I could enjoy their fruit. And today, this little sapling that I'm planting this sapling for my children and my grandchildren." Today, we're planting this beam that all of you have signed into our new Children's Hospital building. Now, across the world, in every culture, a tree is a symbol for life. The beam we're planting today will bring a hope for a better life to generations of children across our state of Iowa who will benefit from the care that they receive in this building. We haven't staked it against the wind, but, and this is true, we have reinforced these windows in this beautiful facade against a level 3 tornado. That we've done, that's true. And if we nurture and we support this building, this children's hospital will be a source of life for many years to come. I'd like to now introduce Olivia Calicut, who's a member of our UI Children's Hospital Youth Advisory Council. Olivia.
Hello, my name is Olivia Calicut. I'm honored to be here on behalf of the Youth Advisory Council, which I joined so I could give input on ideas for the new Children's Hospital. I'm here to tell you a little bit about my story. When I was 4 years old, I was diagnosed with acute myeloid leukemia, a cancer of the blood. At the time, I was introduced to the Children's Hospital. I spent most of my life on the 3rd floor in the bone marrow unit. After my initial diagnosis, I relapsed a total of 4 times. I underwent very intense chemo and radiation therapy along with numerous other treatments and procedures. I later found out that I would need a bone marrow transplant and a stem cell transplant. At such a young age, I had to do a lot of growing up pretty quick. Some of the experiences I went through were very difficult and sometimes hard to understand. However, the child life staff and doctors and nurses were there to assist me and help me through these hard times. As of today, I'm 5 years in remission, and my wish for the children that... My wish for all the children that come to UICH is for them to know that there is no need to be scared or afraid, because the doctors, nurses, and child life staff are going to do what's in their best interest to ensure they are comfortable. My hope is that when they leave, they are healthy, happy, and remember that they will be okay. Now, let's welcome Scott Turner back to the podium.
Thank you, Olivia. And again, a perfect reminder of who we're building this children's hospital for and why we're doing it. I would now like to thank really everyone who's been part of this impressive project and instrumental in getting us to this impressive milestone, especially our construction workers who have been working through oppressive heat and humidity and cold, damp winter days, hopefully not today. It is incredibly exciting to see the dedication and hard work of our staff, construction crew, and community reflected in all aspects of this impressive building. Because of your collective efforts, we believe that the new UI Children's Hospital will be the safest, most technologically advanced, and family-centered facility in the world. Today is your day to celebrate, and I sure hope that you are. If you haven't had a chance, I invite you all to leave your mark on our beams, and I'd like to start by doing that by inviting up the Geenan and Calicut families to leave your mark. Thank you very much for your outstanding support of UI Children's Hospital.